For more latest news and updates, subscribe the Hint.
Capitol Hill negotiators have reached agreement on an $8.3 billion measure to battle the coronavirus outbreak that's spreading and threatening a major shock to the economy and disruptions to everyday life in the U.S. The measure immediately went to the floor for a brief, bipartisan debate. The House will vote on the bill later Wednesday, and Senate leaders are pressing for a vote in that chamber by the end of the week. El Paso Rep. Veronica Escobar said she would vote in favor of the bill. The government's greatest responsibility is to keep Americans safe, said House Appropriations Committee Chairwoman Nita Lowey, DNY. This emergency supplemental addresses the coronavirus and takes critical steps to protect the American people from this deadly and expanding outbreak. Single quote. The legislation came together in little more than a week, a rarity in a deeply polarized Washington. It more than triples the $2.5 billion plan unveiled by President Donald Trump just last week. Trump, however, is sure to sign the measure, which has the blessing of top Republicans like Senate Majority Leader Mitch McConnell, RK, and top House Republican Kevin McCarthy of California. This moment calls for collaboration and unity, McConnell said. It's time to give our public health experts and healthcare professionals the surge resources they need at this challenging time. Single quote. The agreement came together after House Speaker Nancy Pelosi, D-Caliph, dropped a demand, opposed by Republicans in the drug industry, to guarantee that any vaccines and drug treatments developed with government-backed research, but manufactured by drug companies, be offered at affordable prices. Instead, more than $3 billion would be dedicated to research and development on vaccines, medicines for treatment, and diagnostic tests, including $300 million for the government to purchase such drugs from manufacturers at fair and reasonable prices to distribute them to those who need it, which is the standard applied in earlier crises like the 2009 H1N1 flu outbreak. It also would provide more than $2 billion to help federal, state, and local governments prepare for and respond to the coronavirus threat, including $300 million for the Centers for Disease Control's Rapid Response Fund. Another $1.3 billion would be used to help fight the virus overseas. Another almost $1 billion would provide medical supplies and other preparedness steps like $350 million to aggressively go after the virus in hot spots like Washington state. $500 million to buy drugs, masks, and other medical supplies for states, local governments and hospitals, and $100 million for community health centers. It would devote $500 million to Medicare for remote, telehealth consultations that would permit sick people to get treatment without visiting a doctor. This robust, bipartisan agreement goes far above the president's totally inadequate request to actually meet the needs we are hearing from our states, and will help ensure tests and vaccines are available to everyone who needs them, said Sen. Patty Murray, D-Wash. The agreement comes as the outbreak in the U.S. appears increasingly likely to affect workers who are instructed to stay home, immigrants who may fear seeking treatment because they are in the U.S. illegally, and the potential rapid spread among homeless people. Widespread school closures are possible as well. The American people are apprehensive about the spread of the coronavirus in the U.S. and abroad. Global financial markets are on edge, said Sen. Richard Shelby, RALA, chairman of the Appropriations Committee. Both are resilient, but vigorous action is needed to calm nerves, stabilize the situation, and get our arms around this crisis. Vice President Mike Pence, who is coordinating the administration's response, returned to Capitol Wednesday afternoon to separately brief House Democrats and Republicans. Also Wednesday, top congressional leaders met to discuss what additional steps may be needed to ensure the safety of the Capitol complex for lawmakers and staff, as well as the annual influx of visitors this spring. Afterward, Pelosi said it was a good, positive meeting about unity and how we want to protect the Capitol and have continuity of operations for the Congress. Asked whether the Capitol and its visitors center and galleries will remain open, Pelosi said, "Yes, at this time, yes." Single quote. Separately, the Department of Health and Human Services said Wednesday it is providing $35 million to 28 states and localities to help their public health departments respond to the outbreak and also increase their surveillance for the virus. Washington State, which has seen 10 deaths, will get $2.75 million, while California will get $4.5 million. The money should be available to the states by early next week, federal officials said, and comes from more than $135 million that HHS Secretary Alex Azar transferred from other department accounts to help with the coronavirus response.
For more latest news and updates, visit www.thehealth.com.